So good morning, Rep. Nelson, and thank you so much for doing this interview with me on behalf of Disability Rights Louisiana and people with disabilities in our great state of Louisiana. So before we get started, can you just tell us a little bit about yourself and your platform?
Sure. So I'm Representative Richard Nelson. I represent the Mandeville area on the North Shore of Lake Pontchartrain. I grew up in Mandeville, was a valedictorian Eagle Scout, got degrees from LSU in biological engineering and law, joined the Foreign Service, the U.S. Department of State, moved all around the world for about 7 years, protecting embassies overseas from terrorism and espionage. And then decided my wife and I had 2 kids at the time. We decided to move back home to Mandeville and moved back in 2017. We now have 3 boys, 9, 7, and 5. They go to school in public school here in Mandeville. And, I ran for office in 2019, got elected to the state house. Since then, I've been working on a lot of big issues. I'm trying to fix our tax code so we bring jobs and opportunity here to Louisiana, keep kids from leaving. And then also, I've done a lot on education. Like I said, I have, some little ones myself, so it's something I care a lot about. I think those are really two of the biggest challenges Louisiana faces is, really having an attractive climate to have businesses and people, bring businesses and people here. And then also, fixing our education system so everybody gets a quality education.
Great. So I just am gonna get started with my first question. So, what is your assessment of accessibility of healthcare and home and community-based services for people with disabilities?
Sure. So I think this is an important issue I've had in my time in the legislature. I've had advocates come to my office and talk to me about the program and especially the waivers and how important they are so that people are able to get care in their homes. Because, no, not just for disabled people, but also for everybody there. Everyone's always would rather stay home and get the services they need there versus going somewhere else. And so I think the waiver program is very important. I think making sure you have enough spots available so that everybody can fit in there is very critical. And then, one of the things and one of the challenges that I think I've heard is that, making sure that the reimbursement rates are high enough so they can attract qualified staff so that you can get people out there, because just having the waiver isn't enough. But if it's not reimbursing enough, especially with inflation and, how hard it is to find people to work, I think that's one of the challenges. You got to make sure those, reimbursement rates are enough so that you can attract qualified people to make sure people have the care. So I think that's one of the challenges, and that's always a, somewhat of a budget fight to make sure that there's money available for that. But I think it's really critical. And, like I said, I think it's the way to ensure the best care is to have the best people out there working with people.
And what would be your plan to implement these improvements?
Sure. So, I think first is probably to appoint a secretary of Department of Health that is, really competent in a lot of these in these areas, and I think is good at balancing the things that need to be done. And so the appointment to the Department of Health, Secretary of the Department of Health would be I think one of the most important appointments. Not just for that reason, but, the Medicaid program in the Department of Health is about half the entire state budget. So you really need somebody who's really, I think, detail oriented, who can really, manage people well. That's probably the first thing. And then I think the second part is to just really take a comprehensive look at where our Medicaid dollars are going and making sure that they are going to the places that I think really help people the most. And I think that's home and community healthcare. The home and community care is one of the most important things because it really, I think, saves money for the state in the long run, just keeping people in their homes and making sure that they have those services available to them.
It really does. And similarly, what's your assessment of mental health care in our state?
Yeah, so I can tell you, I've gone all over the state, and I would say the mental health care system is kind of in shambles. I don't know if I hear too many good reviews of the mental health services available anywhere. Whether you're in a city, I was in DeRidder last week, and they told me that was one of their biggest challenges. It's a relatively small town, but they said, listen, we have just a few people that are really suffering from mental health challenges, and there's not really a good system to make sure they don't fall through the cracks. Even if they just need medication, right? Sometimes a lot of people, they just need some medication to keep everything in balance. And, they maybe get admitted to the hospital, they may get picked up by the police and put in jail. And there's not really anywhere for them to go when they're released, and nobody follows up to check to make sure. And so what happens is they end up coming back to the emergency room, which is very expensive, or they get picked up by the police and put in jail, which is, again, not the ideal situation. So I would say there's really not a continuous, there's not really a continuous spectrum of care for mental health in Louisiana. It's really just kind of a bunch of different, you're playing whack-a-mole, trying to solve the problem in 1,000 different ways. And so there's not a lot of continuity in what you're trying to accomplish. And I think that's part of the problem. We rely on basically emergency rooms to treat people with mental health, which is not necessary and very expensive, or we rely on the kind of incarceration system, which is also not the appropriate place. And especially if you're not in the position where you need to be in an institution for a long time or, extended period of time, there's not a lot of options, especially in the more rural areas. And so I think really what you have to have is kind of a comprehensive overhead view of just addressing the mental health crisis across the board, making sure that whether you just need, some kind of really short-term acute care so that you can kind of get back on track and sort out some issues, or if you need, continuous medication in order to stay on, to keep everything together, or if you need that more long-term treatment, long-term admittance. I think we have to have a single kind of person, a single person in the Department of Health that's just kind of overseeing that whole process to make sure that all those things are talking to each other. And then you also have the problem of, you have locals, kind of local governments, you got the Department of Health, you have, local public health authorities, and then you have thousands of private institutions and private providers, and not all these guys all talk to each other. And so it ends up being, like I said, kind of like whack-a-mole, where everybody's trying to solve this problem a different way. And a lot of times they conflict with each other. The cops will go drop them off at the hospital. The hospital say, well, what do you want us to do with them? They'll say they need long-term treatment. The long-term treatment facility says this person doesn't have a long-term problem. We gave them some medicine and they're fine. And they say they want to go home. And so I think you really have to have some overall statewide coordination to make sure that all these things are all working together instead of, fighting each other and just trying to pass patients off from one place to the other, which is what I think kind of happens now.
Yes, I agree. So is there anything that you'd like to add that you didn't add before?
No, I think on those two questions, I think that is, pretty comprehensive how I think about it. I think really, the Department of Health has a lot of opportunity to do better. I think everybody can kind of admit that. And I think they have the resources too. We have the Medicaid expansion. We have a significant amount of resources that come from the federal government. And so I think it's just a question of, who do you put in charge to really appropriately make sure that those things are spent well. And, that would be a focus because, like I said, there's a whole lot of opportunity to really improve the lives of people in Louisiana. Really on the front lines, making sure people are treated for the mental health, making sure people can stay in their homes to get the healthcare services they need. I think those are things that will, really save the entire state and the taxpayers money in the long run, but it also provides better care for the people.
I agree. Well, I hope you have a good day and thank you so much for doing this interview with me. We really appreciate it. And I hope you have a wonderful day.
Thank you, you too, Ashley.
Okay.
Bye.